Joining us now to discuss the global health crisis in detail is CBS News medical contributor Dr. David Agus. Doctor, good morning.
Morning, Jeff.
So a lot we don't know about corona, right? What are the symptoms and how easily can it spread as far as what we know right now?
So there are different types of coronavirus. The common cold, about a third of them are a type of coronavirus. But this is an aggressive type of coronavirus that classically goes to the lung and causes an immune response. As that immune response gets greater, it's harder and harder to breathe. And that's what we're seeing in patients, is that they're admitted to a hospital and then slowly it gets worse so they can't breathe. And that's why they pass away from this horrible virus.
And the most vulnerable being the young and the elderly.
Young and the elderly, although we're seeing 20, 30, and 40-year-olds die. I mean, there's an amazing case just reported of somebody admitted to a hospital in China with abdominal pain, and 12 healthcare workers died because they were exposed not knowing they had coronavirus.
So the CDC now has estimated that there have been 12,000 deaths from the flu, just the flu. How worried should Americans be about coronavirus?
Coronavirus is not going to cause a major issue in the United States. If we have it here, we have healthcare institutions that can cordon people off. We can take care of them and give what we call supportive care. Remember, this happened in a part of China where there wasn't great medical systems, which is why they had to build these 1,000-bed hospitals in a matter of a week. So in the United States, won't be an issue. But it just begs you and pushes you, why isn't everybody getting a flu vaccine? We're going to have 40,000 to 60,000 deaths this year in the United States from the influenza, and it's preventable.
And there are only 12 confirmed cases of coronavirus here in the States.
No question about it. Those are enormous difference in numbers, and we have to step up as a nation and start to prevent.
Along the lines of those who do have it, though, and this idea, you and I were talking before the show, is there a vaccination? Is there something that's working in order to finally contain and stop this at some point?
So we have treatments that we think work. They work for similar viruses, and there's some data now they worked in Asia in certain patients, and those are generic drugs that are available that were originally meant to treat HIV or influenza. They work against this type of coronavirus. The clinical trial validating this is ongoing in China, but my gut is there will be some benefit there, and we have these drugs. Supportive care we have, and vaccines are being developed. It's going to be at least a year and a half till we have a real vaccine. But there's hope here that we have these drugs that work.
Go ahead.
No, go ahead.
I was going to say, along the lines, though, then in trying to stop the spread, we see people wearing masks. Is that enough?
So these masks, it's called N95, which means it prevents 95% of things going in. What it doesn't prevent is really small things. Viruses are really, really small, so they will not prevent viruses from getting in, but they will prevent droplets. So if there's a droplet in the air, that mask can catch it. So it's not wrong to wear a mask, but they don't do that much to stop the spread of virus. Oh, they kind of look kind of cool when everyone's wearing a mask.
Well, it's not really cool, but yeah.
I'd rather not have it.
How much worse does this get in China before it gets better?
That's the million-dollar question, is that there's the epidemiologists saying it probably will peak over the next week and then go down a number of cases, and then a second peak in the fall toward the end of the year has classically happened with outbreaks like this. The true answer is we don't know. There's not a lot of transparency in China. They don't have enough tests. They're only testing the people who are really, really ill. The people who are mild to moderate aren't even being tested. So when you're not told you're positive, you go out, you could spread to somebody else. This is a public health nightmare.
Which is why it seems so crazy that people are being kept in their homes, but it's the only way to stop that spread for certain. Dr. David Agus, thank you.
Thank you.